So actually, I think in melanoma, molecular profiling is very important. We have a few situations where we do this routinely. For example, if we want to decide whether a patient should go on a BRAF inhibitor. However, there are by far more data that are important. I think we have a number of medications that are working in other mutational profiles. For example, c-KIT inhibition is important if we can identify certain mutations. For NRAS mutated patients, we might consider a MEK inhibitor. I also appreciate to know about the mutational burden in my patients. So tumor mutational burden is an important feature concerning the outcome of immunotherapy, and therefore I appreciate this. So in Zurich specifically, we have a very ambitious program called the Tumor Profiler, and this is an interdisciplinary approach that aims to investigate many features of a tumor, also features that are helpful to select immunotherapeutic approaches. This Tumor Profiler has several platforms. The first platform is a genetic platform, so we use Foundation 1 to investigate tumor mutational burden, and then many genetic alterations that are relevant for the development of a malignancy. Not only mutations, but also translocations. So we can also estimate which oncogenes are activated by translocations. Then we have an approach that is called digital pathology. So in this approach, we do immunohistochemistry and have a computer-assisted evaluation of this. For example, this is used for the determination of PD-ligand 1. We characterize the T cells that are in the tumor, and we can also determine whether a tumor is hot, which means infiltrated by CD8 positive cells, or cold. And then we have high-resolution platforms that use many different aspects, for example, by CyTOF. And with CyTOF, we can understand what is the heterogeneity of our melanoma cell population. We know about the differentiation and de-differentiation of the tumor cells. We know about the expression of melanocytic differentiation antigens. This is helpful to select the patients for clinical trial. We have, for example, a clinical trial ongoing that is targeting the melanosome-associated protein TRP1. So this is very helpful. And then we can also investigate surface molecules, including checkpoints. And we know whether these checkpoints are associated with their ligands. So we can estimate whether a checkpoint is functionally relevant or not. And this would allow us to select patients, for example, for a treatment with anti-LAG-3. And the last platforms that are involved are functional platforms. For this, we use live tumor cells, and then they are exposed to different drugs and drug combinations. And with this, we get a prediction about the sensitivity, for example, for multi-kinase inhibitors, for certain chemotherapeutic drugs, or drugs that are targeting DNA repair mechanisms such as PARP inhibitors.